Good evening, guys. Here's C for you. We're discussing a study done for the rising burden of ischemic heart disease, or IHD, across different countries. So we're going to discuss that for discussion C. So please join me in the presentation that I made. Okay, here we go. This study highlights the rising burden of ischemic heart disease, or IHD, across Southeast Asia, East Asia, and Okinawa, emphasizing the need for localized equality, focused interventions. Researchers identified region-specific modifiable risk factors contributing to the increase prevalence of IHD, such as toxic air pollution in East Asia and ultra-processed dietary dependence on Okinawa. HD occurs when plaques build up, narrows arteries, reducing blood flow to the heart and preventing reducing blood flow to the heart and arteries, reducing blood flow, preventing it from receiving enough oxygen. The most common symptom is chest pressure or pain, and patients are at risk of heart attacks or arrhythmias. Treatments include medications, angioplasty, or coronary bypass surgery. Okay. Okay, page 1 is done. The study, led by Hardrick Dinesha, a clinician scientist affiliated with the Global Burden of Disease study, aims to bring attention to the rapidly evolving cardiovascular crisis in these regions, which collectively represent over 2 billion people. It will be presented at the ACC Asia 2025 together with SCS 36th Annual Scientific Meeting in Singapore. Modifiable risk factors for ischemic heart disease, or IHD, are lifestyle and environmental factors. That can be changed to reduce the risk of developing the condition, Based on the study findings, some region-specific modifiable risk factors include toxic air pollution, especially in East Asia, ultra-processed dietary dependence, notably in Oceania, next page. More broadly, common modifiable risk factors for IHD include high blood pressure, high cholesterol, smoking, diabetes, obesity, physical inactivity, unhealthy diet, high in saturated fats, trans fats, and refined sugars, excessive alcohol consumption, chronic stress. Addressing these factors through dietary improvements, regular exercise, smoking cessation, and pollution control measures can significantly lower the risk of IHD. Okay. Next page. Recent research highlights several studies supporting the modification of ischemic heart disease, or HIHD, risk factors. A study presented at the ACC Asia 2025 scientific meeting found that toxic air pollution in East Asia and ultra-processed dietary dependence in Oceania are major contributors to rising IHD rates. Other study from the Global Burden of Disease 2021 analyzed modifiable risk factors such as high blood pressure, unhealthy diet, and air pollution, showing that deaths from heart disease linked to these factors increased by 2.4% East Asia over these decades. Research published in the European Heart Journal found that shingles vaccination lowers the risk of cardiovascular events. Including stroke, heart failure, and coronary heart disease by 23%, just suggesting that immune health plays a role in heart disease prevention. A study from the University in Japan showed biological age rather than chronological age can better predict cardiovascular disease risk, emphasizing the importance of lifestyle interventions to slow biological aging. Findings from the Society for Cardiovascular Angiography and Interventions, which is SCA 2025 scientific sessions, revealed that tobacco use could increase coronary heart disease deaths by 40% in the next 5 years, while cannabis use disorder raises the likelihood of cardiogenic shock, heart attacks, and arrhythmias by 50%. Folks, this is a crisis in the world. People in these countries need to pay attention to what they are hanging around, what they are eating, environmental things that could play a factor in these. These studies reinforce the importance of lifestyle changes, environmental policies, and preventative health care in reducing IHD risk. Would you like insights on specific interventions based on these findings? Down from that, you got these findings have major public health implications, particularly for regions experiencing a rising burden of ischemic heart disease or IHD. Here's why they matter. Targeted prevention strategies. The study highlights region-specific risk factors such as toxic air pollution in East Asia and ultra-processed dietary dependence in Oceania. This means public health policies must be tailored to address these unique challenges rather than applying one-size-fits-all approach. Health inequality and access to care. The Global Burden of Disease 2021 study shows that lower and middle income regions are experiencing higher IHD mortality rates, while high income regions see declines. This underscores the need for equitable healthcare access, including early screening, primary care, improvements, and better cardiovascular disease management. Environmental and policy interventions. Air pollution is a major contributor to IHD mortality. Governments must invest in environmental governance in enforce clean air policies, and regulate industrial emissions to reduce cardiovascular risk. Okay, then you go down, dietary and lifestyle changes. Research suggests that low omega-3 intake significantly contributes to IHD burden. Okay, hold on. Public health campaigns should promote heart healthy diets, encourage physical activity, and reduce tobacco and alcohol consumption. Global surveillance and research. The study calls for better surveillance systems to track uh, epidemic trends and risk factors shifts. Future research should focus on big data driven prediction models to optimize resource allocation and intervention strategies. These findings emphasize the urgent need for action to curb the growing IHD crisis. Would you like insights on specific policy recommendations or intervention strategies? Okay, then we go down to address the rising burden of ischemic heart disease. Policymakers should focus on targeted interventions that tackle modifiable risk factors and improve health equality. Here are some key recommendations. 1. Environmental and air pollution policies. Strengthen air quality regulations to reduce exposure to toxic pollutants, particularly in East Asia. Invest in clean energy and public transportation to lower emissions. Moderate industrial emission controls to limit cardiovascular risk. 2. Dietary and nutrition policies. Regulate ultra-processed foods by enforcing clear labeling, and restricting harmful additives. Next page. Okay. Subsidize heart healthy foods like whole grains, fruits, and omega-3 rich fish to encourage better nutrition. Okay. Launch public awareness campaigns on dietary risk linked to IHD. 3. Healthcare access and preventative care. Expand universal health care coverage to ensure early screenings and treatment for IHD. Increase funding for primary care to improve cardiovascular disease management in lower income regions. Promote telemedicine to enhance access to specialists in underserved areas. 4. Tobacco and alcohol control. Raise taxes on tobacco and alcohol to discourage consumption. Okay, ban misleading marketing that targets vulnerable populations. Expand smoking obsession programs with free counseling and medication support. 5. Research and surveillance. Develop big data driven prediction models to optimize resources allocation for IHD prevention. Strengthen global surveillance systems to track epidemical trends and risk factors shifts. Fund research on emerging cardiovascular risks, including climate change impacts on heart health. These policies can help reduce IHD prevalence, improve public health outcomes, and create sustainable healthcare solutions. Would you like insights on how different countries are implementing these strategies? Okay, guys, so that is it for tonight. I will be on tomorrow sometime. So I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.